I think what sets IU apart in terms of research opportunities is how many departments we have in medicine. I know a lot of my friends have gone into very niche fields like radiation oncology and vascular surgery, and you might not get those opportunities elsewhere, but because we have departments here and research going on within all these departments, students are able to get involved really easily.
When I was in college, I was involved with a lot of basic science research, and when I came to medical school, I sought out a lot of clinical research experiences, and one of the first people I talked to was Dr. Landman of pediatric surgery, and I got to be involved in a project on bowel surgery, and I did the IMPRESS research program, which funded my research, and I got to get my first research experience in clinical medicine. I've always been really interested in research, but once I got to do some clinical research, I found that I really loved it and that you can help patients in a more direct way. And so after I did my pediatric surgery research, I found an opportunity through the MedStar program, the Medical Student Research Fellowship program run by Dr. Kurt Kroenke. And I got to take a bunch of amazing classes and then work in a pancreatic cancer lab with Dr. Mendoza. And I really loved that because we were looking at these two drugs and seeing how they could increase radiation-induced cell killing in pancreatic cancer. And I felt like that really translated to the clinic and found that really rewarding.
I think coming into medical school, I was definitely not interested in bench research, but I didn't know how much clinical research would be exciting for me. And so that definitely took me by surprise. And I think it was just because I saw how much of an impact it could make on my patients. It's just so important to make sure that what we're doing for our patients is grounded in evidence and make sure that it works for that individual patient. So it's always good to be able to go back to research and understand what will work. My probably favorite part of being involved in research was just everyone I got to work with. I met so many amazing people who have been so established in research, and it's just really inspiring to be able to work with them and work alongside them and get their valuable opinions on what is important with research and what they have used with research to incorporate into their practice.